Well, hello everyone, and welcome to another episode of You've Got the Power. I'm your host, Dr. Jason Deitch, and of course, we are here with Chief Medical Officer of the Centeno-Schultz Clinic, Dr. Chris Centeno. Happy Monday to you, Doc.
Happy Monday, Jason.
We got a great show today. As you know, we do our best to stay focused on a whole variety of topics. Many of you appreciate, of course, craniocervical instability. Today, we're going to tackle the topic of exercise, physical therapy. What else are we talking about? We got to get into craniosacral therapy. There we go. When you've got craniocervical instability, what do you need to know about exercise, physical therapy, craniocervical instability? Doc, what do people need to be aware of?
Yeah, so this is a big topic because on the front end, people who end up with a craniocervical instability or CCI diagnosis end up usually at some point getting a physical therapy or an exercise prescription. And on the back end, after they've been diagnosed with CCI, the question is at what point after which type of procedure can you begin exercising, and is there any value in doing so, or is it a net negative? So those are sort of the two things to cover here.
Let's get into, I guess, when it comes to things like exercise, there is, should I be out exercising? When it comes to physical therapy, it's sort of what motions or movements are okay for me to do. I do know both chiropractors and physical therapists, let alone surgeons and all kinds of doctors, are often not very familiar with craniocervical instability. So let's start with maybe what kind of communication should somebody who has that diagnosis, how do they know they're seeing the right type of chiropractor, physical therapy, craniosacral therapist, and so on? And is there sort of some language, codes, or instructions you would recommend that a person suffering from that condition would give to a local provider that they might be working with?
Yeah, so when it comes to exercise and CCI on the front end, it's very common for patients to report that any kind of exercise, whether it's just going out and working out, or walking, or even physical therapy exercises, generally make them worse. That's one of the things that's almost diagnostic for craniocervical instability is exercise therapy that might make some people better, generally makes them worse. So that's the first thing we need to know. And then as far as exercise prescriptions for CCI, really the problem there is that there's usually too much ligament instability that leads to extra motion so that activity can make it worse. So then the question becomes, at what point do you transition into starting to exercise, and why is that important? And that's getting into the idea of the different, or how a joint is stable. A joint is stable through its ligaments, and a joint is stable through its muscles. So those are some additional things to talk about.
If you're watching, if you've been suffering from craniocervical instability, if you work with people who suffer from craniocervical instability, share with us. What's been your experience? Have you been able to exercise with it, or has it been sort of that telltale diagnosis sign that sort of indicates, you know what? Exercise is just one of those things that when it happens because of my instability, things start flaring up. Hear your experience. And if you've got questions, now is your time. You're on with Dr. Chris Centeno, the inventor of one of the most significant procedures that many people, thousands of people report remarkable changes and relief using. And Doc, I do know that there's a lot of just sort of question of, how fragile is fragile? And do I protect everything, or how do I know when it's safe and I'm not going to actually cause more damage? Are there things people should know themselves to be able to sort of self-identify, I can push it here, or I really better protect myself and not try to overdo something and undo whatever work might have been done?
Yeah, I think that we need to, so let's back up a little bit and talk about basic concepts. So a basic concept here is that if you have a joint that is moving around too much, there are two components that can keep it stable. One are the ligaments, and the other are muscles. And they're equally important in providing stability. So if you're going to be cured, in quotes, of CCI, we've got to both deal with the ligament side, and then we've got to deal with the muscle side. And and that really then leads right into exercise and getting stronger and treatment, because in order to get there, we have to have enough stability in the ligaments, enough ligament tightening so someone can tolerate muscle strengthening. So usually for things like the PICL procedure, that means that someone's done at least one procedure, sometimes two procedures, before we're trying to get them involved in strengthening the muscles that hold the head on. And sometimes that's a give and take. So for instance, we have an exercise program that we've put together that goes through various levels. And sometimes after the first or second procedure, when they're cleared to start doing those exercises, they can only get through level 1. And then after another procedure, they can get to level 2 or 3, and so on. So it's always that balance between getting more stability and getting more strength, but the strength needs to be there. And I think that's a key thing that a lot of CCI patients forget, is that there's substantial and significant muscle atrophy that happens with this problem. We can see that atrophy very, very easily on MRI. And you need to get that strength back if you're going to get into that bucket of patients who are dramatically better and able to do mostly what they want to do.
Doc, what role does age play into this conversation? Somebody who's younger versus somebody who's more senior, does that matter, or are the principles the principles?
The principles are pretty much the principles when it comes to something like this. Obviously, older people tend to, maybe they strengthen less. But what's interesting about muscle studies in an age is that those people who are exercising throughout their life and working those muscles generally have muscles that look more like younger people's muscles on biopsy than older people's muscles. So there's an effect there of exercise which goes beyond age. And it's a pretty interesting thing, is that simple keeping up with your exercise can make your muscles look like much more like a younger person's muscles than an older person's muscles who doesn't exercise.
That's great to bring out, because one of the points I hope viewers understand is how much agency, how much impact they themselves can have, both on their condition and on their health overall. I know many of the questions sort of come in with this sense of curiosity of whether it works, whether a procedure works, a technology, a doctor, thinking that it's really up to you to make the impact on the body. And that's partially true. The other part of the truth is it has everything to do with the individual person. So in the spirit of you've got the power, it's important to understand that you do what you do, how you exercise, how you stretch, how you care for yourself, your rest, your nutrition. Sort of what you bring into the doctor has everything to do with how well the doctor and the technology's results are able to impact you as an individual. And that's the nature of studies, right? They are across the board and then sort of averaged out, but everybody is unique and individual. You want to comment on that, or should we head over to some questions coming in?
No, let's head to some questions.
Terrific. This was submitted in advance by Tamara Reynolds, who asks, how long after the procedure does PT start? Is there a particular type of physical therapy that is needed?
Yeah, so this is a great question, and a lot of it depends on how the patient is responding to the procedure. So for instance, let's take two different scenarios here. In the first scenario, someone has the first procedure and they feel substantially better. Let's say they're 30% better overall. They can hold longer between chiropractic adjustments. They have had their symptoms go down and they feel like they can do more before they get symptoms. In that case, that's a good time for someone to start rehabilitation. And what I mean by rehabilitation is that's going to be very specific to the person. But in general, we have exercises online that the person can access to start that process of trying to get the upper neck muscles stronger. So these are online exercises to do first. There may be other things we're recommending for that person, i.e., if they don't have a normal curve, to get the curve back, etc. So that's one scenario. Now, a second scenario might be the person goes through the first procedure, they're 6 months out, they're really not much better, and we know they've got craniocervical instability based on all of their metrics. Everything fits with craniocervical instability, so they need a second procedure. We're generally not going to recommend that they start treatment yet. So those are two different things to look at there. So a lot really depends on how the patient's doing physically after their procedure. A third scenario might be the person's better after the first procedure, but still very disabled. They have less symptoms, but they're not able to do much at all, in which case we might wait till after the second procedure to start exercise. And the exercises we want you to start are online. And that's a program that goes through level 1, 2, 3, 4, 5. And we've got all of that written out on a web page that we can send you.
Outstanding. The second part of her question was, is there a particular type of physical therapy that's needed? And how does somebody pick and choose? How does somebody know whether they're working with the right physical therapist that either does understand what this is or doesn't, and either is willing to learn, or maybe they should say thanks but no thanks and go somewhere else? How does somebody choose?
Yeah, that's a really hard issue to deal with because the average physical therapist is not going to have any idea of how to do this. So that's why I'd much rather either have you do the specific exercises that we have online, or get a very specific physical therapy prescription based on your particular issues. We also have a list of physical therapists around the country who are at that level that they can understand this stuff. So, but again, that's going to be highly individualized, and we generally like people to start with the exercises that we have online for that reason, meaning it's very hard to get or find a physical therapist who will really understand what's going on.
I think this is all part of what I hope people understand, that when they really work with the doctors at Centeno-Schultz, specifically Dr. Centeno and Dr. Schultz as it relates to PICL, that you're not just getting another group of doctors doing another group of services, that you're really working with the inventors of these procedures, the absolute experts in this condition, and not just what they do to you and with you, but what you need to do for yourself. This is a highly specialized specialty that, although many doctors know the words cranial cervical instability, they don't understand the complex and the impact. And they don't have the experience that you do get when you work with Dr. Centeno or Dr. Schultz. Let's get back to more questions. We've got Maria Malisova who asks, I have CCI and do muscle strengthening for my C-spine, which is the only thing which gives me a bit relief in my symptoms. So she's saying she can get some relief by doing C-spine, means your cervical spine, and that can be very helpful as well. You want to comment on that, Doc?
Yeah, well, definitely an atypical CCI presentation, but not a bad thing, a good thing. So that means that we would move you forward in more aggressive rehabilitation much more quickly.
It's often hard for people to sort of predict and sort of see their future. You know, should I be exercising? Should I get another procedure? Should I just be patient? You know, what should I do? And so that's very much what this program is all about, is you get to ask those types of questions here. Maria, thank you for your feedback and your contribution. This was submitted earlier in advance by Roberta Lane, who asks the question, if I haven't been able to tolerate PT, would I be able to tolerate it after I get the PICL procedure? That's exactly the kind of question I'm expecting.
Yeah, so again, the focus here is to obviously listen to your body. and for us to assess whether or not you're ready to start strengthening. So as I had said earlier in the program, if we do, for instance, one PICL procedure, you have substantial symptomatic improvement, then that's a good time to start working on some of the exercises that we have listed online. And then you might get to a certain level, meaning those are level 1, 2, 3, 4, etc. And then we may need to do another one to get you further to the next level on the strength scale, if you will. But the ultimate goal is to get you stronger and being able to do exercises, maybe not working with the garden variety physical therapist, because if we don't do that, we can't get you back to anything approaching normal, meaning, again, stability is half ligaments and half muscle. So in order to be back to normal or close to it, you have to have tight ligaments and strong muscles.
We had a great conversation with Pam last week, sharing her experience, which was wonderful to hear from real people having real healing experiences. She kept finding improvement, each procedure she did up to her fourth one, and couldn't be more excited and ecstatic, thus her coming onto the program and sharing. If you didn't see that show, scroll down and look for last Monday's show with Pam. And you'll have a great sort of insight into real people's real experiences. We got more questions here. We got Ben Robertson who asks, hi, do you guys inject the posterior longitudinal ligament at Regenix? What role does this play in maintaining stability in the spine? I was just wondering whether this can be injected, as I have significant damage to this in my cervical spine. Thanks, from Ben Robertson.
The posterior longitudinal ligament can be injected. It's just higher risk because it's at the back of the disc. So in order to inject that, we'd have to go through the front and then into the anterior longitudinal ligament area, and then through the disc into the posterior longitudinal ligament area. So it can be injected in the lower cervical spine. As far as in the upper cervical spine, that's a little bit easier because we're already in that space. And it's not called the posterior longitudinal ligament. In that place, it's called the tectorial ligament. So we can inject it much more easily in the upper neck. In the lower neck, it requires us going through the intervertebral disc. So it's just, it's like anything else. It's risk benefit. So we have to see that there's a potential substantial benefit to taking the additional risk of injecting that particular structure.
All righty. Thank you for your question, Ben. We're here if you've got a follow-up. Betsy Bats says, yeah, can't exercise, feel sicker. Even going for a 15-minute walk is horrible. Have had CCI for 15 years, had 2 alar stem cells, need 2 more PICL. Where are the online exercises, she's asking? Is it on Regenix or is it on Centeno-Schultz? Because she says, yeah, most PTs don't know what to do.
Yeah, those are on Centeno-Schultz. So if you go to the Centeno-Schultz site, I'm going to go ahead here and see if I can find that for you. And I will go ahead and send that to Jason so he can put it in the show notes.
Perfect. We'll get that up and running if possible. Doc, for people who are relatively new, until we have more questions, help people understand, what exactly CCI is, and I guess most importantly, not just sort of the textbook definition necessarily, but how would somebody self-assess themselves? How do they know if this is just, neck pain, headaches, symptoms, or if this may be perhaps the complex of CCI, and what should they do if they suspect it's CCI?
Yeah, so CCI means that it's craniocervical instability. The ligaments that hold the head on have been damaged, and hence the area where the head meets the neck moves around too much. That can lead to everything from irritation of nerves to damaged joints, to irritated tendons, muscles, banging into the spinal cord, etc. So and CCI diagnosis is made based on a couple of things. Number one, there's got to be some reason why that person has CCI. So is it related to trauma or an old trauma, or is it related to something like EDS, where the ligaments are just too stretchy? Number two is they've got to have symptoms consistent with CCI. So there's a whole host of symptoms, everything from headaches, dizziness, imbalance, rapid heart rate, lots of other things that form a sort of complex of most common CCI symptoms. And you can find that on the Regenix blog if you're interested, because there's a list of symptoms there. That's also in the book that I recently published. And then another is that there's got to be imaging evidence of CCI. That's either on something like a DMX or MRI. So all of those things have to fit in order for us to make a diagnosis of CCI that might require treatment.
That is super important for people to understand. Number one, I did just post those exercises, so that link is down below. If somebody suspects that they may have these, combination of symptoms, let's just talk through what the next steps are. I know you offer either virtual telehealth consultations, or they can schedule to come into the practice. Help people understand, why it's important to get these things discovered early. Too many people suffer, oftentimes letting the problem get worse over time. That the most dangerous statement is, I hoped it would go away, and they just sort of hope it will go away. And these things don't just go away, even though symptoms may come and go. What do people need to know about sort of the way the body works? That there's pain, which is a symptom, and then there's the problem, which is always there, whether you can feel that symptom or not. How do people know, and what do they need to know about going, you know what, I should get this checked out now, as opposed to hoping it'll go away and waiting till later?
Yeah, well, the biggest thing, if this is CCI, is trying to get to an early diagnosis. That's sometimes hard for people. They tend to bounce around the system quite a bit, so they don't really get to the appropriate people to get the diagnosis very quickly. So it's and really the consequences of not getting a quick diagnosis can be damage to the upper neck joints that can be harder to fix, or damage to other structures that can be harder to fix. So I think the answer is trying to get to the right doctor quickly enough to get a CCI diagnosis, and then from there trying to get into treatment as soon as possible, so that you don't end up in a situation where nothing can help. And that's a hard thing, because a lot of times, like I said, people will bounce around for years before getting an appropriate diagnosis.
If you have been suffering from CCI, if you suspect a friend or family member might be suffering from CCI, if you're in a group where people are wondering, are these symptoms potentially CCI symptoms, have them work with the expert. That's as simple as that. There's a lot of guessing. There's a lot of time wasted. Conditions get worse over time. The longer somebody is bouncing around from doctor to doctor, hoping someone comes up with something, the longer someone is going to suffer, because time matters in these things. So this is why we spend the time, invest the time in reaching out to all of you. But we're only as powerful as the people all of you can help us reach. So if you've got friends or family members who are suffering, have them at least get checked out and find out, is this CCI? If it's not, wonderful. Now you can sort of check that box and get back to what might be those other potential solutions. But if it is, then you want to make sure you're going to the specialist that really specializes in working with people with these conditions. We've got our friend Roger Chin, who's saying hi. Hey, Roger. He's got a question who says, I had SCP, stem cell plasma, injected into my knee when I had my PICL number 2. He's asking, how does the 90 milliliters of bone marrow aspirate get divvied up?
Yeah, I don't know how yours was divvied up specifically, but I can certainly say that if you have SCP, which is really super concentrated platelets, so not really many stem cells in PRP, or platelet-rich plasma, which is what that is. So not a stem cell product, but as far as the bone marrow is concerned, usually we'll end up using, of that 90 mLs, anywhere from 30 to 60 mLs of that on the neck. Now, we don't do 30 to 60 cc's, that's concentrated down. So we might get, let's say, 3 to 6 or 7 mLs of concentrated bone marrow. And then to that, we'll add some high-dose PRP and some high-dose platelet lysate. So let's say we have somewhere between 6 and 10 mLs to inject. Usually about 1/3 to 2/3 of that is used to inject the neck, and then we'll generally have some left over. Sometimes if the patient has issues in their knee, we'll put that in the knee, or if they've got other areas to treat in their spine, we'll use that to treat those other areas.
Very, very good. As we wind up our show, I guess, let's talk about what else people need to know. We talk about exercise, we talk about physical therapy, but this show is You've Got the Power. So we mentioned briefly, what else do people need to know? How important is rest, nutrition, positive mindset? Are there other things like massage or acupuncture, or other things that people can do to help relieve some of these symptoms that you would actually recommend?
Certainly, if massage feels good, that's great. Sometimes it doesn't in this patient population. Again, if acupuncture feels good, that's something else to look at. Doesn't always feel good in this patient population as well. So those are different things to consider. When it comes to other types of treatment outside of exercise, upper cervical chiropractic can usually be very helpful in most of these patients. So that's definitely something else to think about. So those are the kinds of other treatments you should be looking at and trying. But, you know, for instance, let's take upper cervical chiropractic. That works for maybe 70% of these patients. So that's a high number, but that still leaves 30% where that doesn't work. Or when it comes to something like massage therapy, maybe 50, 60% of our patients can tolerate it. The rest really can't. So, these are highly individualized recommendations based on that person.
As I've said before, I'll say again as we close up our show for today, the reason we do this program is to really be a community outreach. There are too many people who are sick and suffering from these conditions and just don't know where to go. As many people have complaints about what social media is, I'm a big advocate to believe that these are exactly the tools that are necessary for doctors to speak directly to consumers, to all of you, and share with you what's possible, especially when it's not something that's advertised over and over and over daily by the pharmaceutical companies. There just isn't the type of press support, media support, because of all the sponsorship of a big pharmaceutical company or commercials. So this is really the way that people learn about and discover what they can do for themselves for conditions just like these. And if you're suffering from any of these symptoms, the message is please don't wait. And if you're not suffering, but you know people who are, the message is please share this with other people. That's the way people learn about things in today's day and age. And you've actually got to be a little bit more skeptical, perhaps a little bit more cynical when it is the mainstream popular thing to do. We've talked about large hospital organizations and the institutional momentum that oftentimes prevents them from being able to do this type of research or to be able to pivot and make these types of changes or be aware of things that aren't the establishment. And the establishment in medicine is very much, is there a drug for it? Does insurance cover it? Is it part of the system that these big medical institutions can get reimbursed for? Very well. Now, if you work for a hospital, then your best interest is to go that direction. But if you're looking for best results, your best option is to find the most conservative option, not the one that's going to lead to more drugs and therefore more surgeries, but the one that's actually going to get you well as inexpensively and quickly as possible. that is actually slightly different than most hospitals' agendas with the massive buildings, lots of doctors, massive overhead that they have to support by doing more and more procedures. Doc, let's wrap up today's show. We're talking exercise, physical therapy, CCI, hoping people will share this information with others. What do they need to know? Let's wrap up today's show.
Yeah, biggest thing is that flare-ups to exercise for CCI patients are really, really common. That's in fact almost diagnostic of CCI. And so you've got to be careful in getting stronger as we tighten down ligaments through something like a PICL procedure. But you do have to get there at some point if you're going to get most of the way better, meaning normal stability requires normal ligaments, or at least ligaments that are tight enough to protect the area, and then strong muscles. And the muscles atrophy in CCI. So at some point, we got to cross that bridge of getting your muscles stronger, or else there's no way to get you maximally better with CCI. And I think it's a critical point. Pam brought it out last week. If you haven't seen the show where we interviewed Pam, you should do that because it's one of the things that she did and she was really dedicated about and tried multiple different types of things. And I think it really made a big difference in her recovery. So again, strong ligaments, strong muscles are required to get that best result.
Outstanding. Roger follows up and says, thanks, guys. Hope you have a great week. Roger, we say thank you as well. We'll say thank you to all of us for joining us. As I wrap up, if you're wondering whether you have coverage for a procedure like this, you should check out the website regenxcoverage.com. regenxcoverage.com to find out if you have coverage for this PICL type procedure from your employer specifically. It is a specific employer-provided program for those of you that are fortunate enough to have this type of coverage. Do you have time for one more question on Damien, or do we need to wrap it up?
No, sure, yeah.
Great, okay. Damien just snuck in here. He said, good afternoon. Damien, thanks for being a regular viewer. He says, I saw Dr. Mussman at Regenx at Gold Coast Orthopedics. Dr. Mussman and his team was professional and cordial. He answered all my questions. I will be having my PRP treatment on Wednesday. Damien, thank you. Thanks for that feedback. Thanks for sharing. Hopefully this program is making that kind of impact with many of you. This is an opportunity for you to learn from the best. I should go this way, from Dr. Centeno, about how to think about your injuries, about what these different types of, I'll call them technologies, stem cells and PRP and what they are. They're all fancy names for your body healing itself. Is using your body to heal your body. It's what I think of as the ultimate in personalized medicine. You've got an amazing pharmacy inside of yourself. And before you start going for the dangerous, risky, expensive stuff, why don't we make sure that you've done everything you can to naturally let your body heal itself? That's what they do at Centeno-Schultz Clinic. And that's really what Dr. Centeno's research over all these years has been all about. That's our show for today. On behalf of Dr. Chris Centeno, I'm Dr. Jason Deitch. We always thank you for watching. Our one request, please engage with us, leave comments, and share with others this program to people that you believe can benefit from just either listening, asking questions, getting access, connecting with others. Thanks for sharing. We'll talk to you soon. Keep an eye out for our next program. We're here Mondays on the Centeno-Schultz Clinic. Fridays, we're on the Regenx page. On Fridays, we occasionally are missing a few because of travel, so keep your eye out. The best thing you can do is make sure you subscribe, so when we go live, you get notified. Until then, have a great week, everyone. Stay safe, be kind. Thanks for watching.